Hello everybody and welcome to the latest BIA Brexit webinar on the 26th of November 2020. We've got quite a packed and I think timely agenda for you today, which we'll try and get through as quickly as we can. But just before we go through the agenda quickly, I'd like to introduce some colleagues we have joining us from the Office for Life Sciences. First, we've got Rob Reed, who's Head of Regulation and Engagement, Elspeth Bailey, Trade Policy Advisor, and Jessica Kirby, Senior Policy Advisor. Unfortunately, Rob's having a couple of technical difficulties at the moment, so we won't be able to see his camera during the presentation, but they will, I think, drop off for now and then join us in a little bit where we can introduce them more properly, and they'll be able to take us through some specific end of transition guidance that the government's prepared. So moving on to the agenda, so the first thing we're going to look at is the latest news, so some of the headlines, then specifically focusing on do we have a deal, looking at the timetable that I think we've shown you in previous webinars, focusing some of the implications for our sector, and then more broadly, are the country and the sector ready for whatever deal there might be, or for no deal if there isn't a deal. We'll then move on to the presentation from our colleagues from the Office for Life Sciences, focusing on end of transition guidance, and then there'll be an opportunity for some questions and answers before we conclude. Steve, do you have a couple of thoughts on sort of some of the tone for today?
So Tim, thank you, and thank you for colleagues from Office of Life Science for joining us. I think you've really got the most up-to-date people here with the guidance. I suppose, where are we at the moment? No jokes today, nothing very light-hearted, I'm afraid. I think it is time for hard hats on. I think we are only a few weeks away from what is going to be a very hard end of the year, whether there is at the last minute a rabbit out of the hat or not. There is lots that is going to change, and I think it is going to be a bumpy time. I think it is vital that industry are as prepared as they can be, and I know many people have done very, very, very much work, but I know people have been doing that against a time frame that's been immensely compressed. And I know that that is a challenge, and we reflect the challenging times that you've been working under back to government. The officials we have with us, I know, are working very hard to try and make things as easy and straightforward as possible, but they work in a context where things are uncertain as well. So I hope by the end of today, you will have understood our analysis of where we are at, understood what I'm saying to government and increasingly in public, and then you'll have the chance to, if you like, check in as to what it is possible to be prepared for, and with the experts to guide you through what may be possible and what the expectations are. Tim.
Brilliant. So without further ado, sort of the latest news. So there hasn't actually been a great deal of new news since our last presentation at the end of last month. But you may have seen this week, there was a speech from the President of the European Commission, Ursula von der Leyen, where she touched on Brexit. She spoke about the progress that had been made, but also highlighted the three issues that I think we've become quite familiar with now that are outstanding: the level playing field, governance, and fisheries. And we'll come to those three issues a little bit later. She also said this quite telling phrase that trust is good, but law is better. And I think this alludes to the fact that potentially in negotiations, I think the UK is looking for a general good faith understanding between the parties, whereas the EU wants a few things more enforceable by law in whatever free trade agreement that we have. You may also have seen that French authorities trialled some elements of their new border arrangements this week, which are resulting in 5-mile HGV queues on the M20. I think regardless of whether we have a deal or not, these queues will form from the 1st of January, but we can't really be certain whether they'll be this bad, worse, or much better, because there are just too many variables at this point. But this was a fairly sort of grim if crazy things have happened this week.
And I think it goes to show, Tim, that if this is a practice of a small part of the numbers of things that need to change, there could well be multiples of complexity that need to be gone through. This is just a small example of one of the things that's a factor beyond the UK government control, which is how the French choose to run their side of the border. So we always do the poll, and keen to do so again today. So fingers on the buzzers, please. Do you think the UK and the EU will have a free trade agreement before the 31st of December 2020? Same question as always. I don't get to vote. Panelists don't get to vote, rightly, as proper civil servants, but you do. Please Please tell us how you're feeling, what you think. Do you think there's going to be a deal? Will there be an agreement? Will the UK and the EU agree a free trade agreement before the end of the year?
And so this is a question. This is a question that we've been asking well for the past few months, and I think the question now may be more what kind of deal or how robust a deal do we get? But that's perhaps a bit more nuanced than we're able to put into a simple poll like this. So we've almost got over 90% of people have voted now. Just give it another 2 or 3 seconds for any stragglers. Closing the poll and sharing the results.
42-58.
Yeah, it's getting extremely close, and I think if we compare that to recent polls that we asked the same question, you can see that it's not too dissimilar to a month ago, with perhaps just a fewer people thinking that we will have a deal by the 31st of January. So people are still feeling relatively upbeat and positive. So with that,
of December, and yeah, no, it's interesting, isn't it? So that's where we're at. So let's see, and that's interesting where your colleagues are if you're interested. Move on, Tim.
Yeah, and hopefully won't dispel too much of that optimism in our next couple of slides. So do we have a deal? I think some of you may be familiar with this slide, which we've shown over the past few months, just to explain the different routes towards getting to a deal. And you'll see here the potential mid-November EU Council summit, which didn't happen, which means that we're about here now, and we're just going to sort of go into that in a little bit more detail and focus on what some of the next steps might actually be. So as I said, we're currently in emergency negotiations heading up to December. The potential mid-November EU Council summit didn't happen. The announcement that we're now expecting is potentially going to be next week, although I think it's been next week for the past few weeks. So it would be incredibly disappointing, worrying if it weren't next week, but perhaps not surprising. And it may be that next week is no deal, which would obviously result in no deal. But if we are to get a deal, there will likely need to be a sort of council political endorsement, and I think something coming out of the UK government obviously announcing that a deal has been agreed in principle. Then it would take a bit of time for that deal to actually be published for us to scrutinise, and even more time for it to be translated into all the different languages of the European Union, and for legal checks of that language, because it's not just enough for you to get a gist of it. In French, in German, it has to mean exactly the same thing that it means in English, so there is no potential legal dispute based on different meaning and different diction of the different draftings of the deal. So it can take quite a lot of time to do this. Then we'll need the EU Council's formal approval. The EU Parliament will need to consent, and the UK Parliament will need to ratify it as well. Obviously, the end of December here, you're looking at the Christmas period, which might make this a lot tighter and a lot more difficult, and a lot more people a lot grumpier and more distracted about the process they have to go through. But I think it's also important to underline the short timescale for the scrutiny here, because at the end of last year we had quite a rushed period of scrutiny from the UK Parliament of the withdrawal agreement, and that led to I think the government changing its position on that agreement and bringing in some legislation through the UK Internal Market Bill, which potentially breaks some of the elements of the withdrawal agreement, suggesting that we weren't quite sure what we were signing up to. So there's a worry that may happen again for any deal, and so scrutiny is incredibly important. The other thing, we spent quite a bit of time going into the different ratification procedures for different levels of deal on the 4th of September webinar, and I'd urge you to go back and look at that again. Basically, for a deal which is incredibly comprehensive, individual national parliaments will also need to consider it and offer their consent. I think you might remember, I think it was back in 2016, the Wallonian Parliament in Belgium rejected the CETA deal, and it had to be redrafted before being put back to that parliament. There's almost certainly no time for national parliaments to give it that kind of scrutiny this time round. So whatever we end up with, it's likely to be quite a skinny free trade agreement at this stage, but there might be some kind of workarounds that they can do, or fudge where there may be some kind of implementation or ratification period. But I think there's a lot of will on both sides to finally get Brexit done and to have something by the 31st of December. So I can't see there being an extension to the transition period specifically at this stage.
So Tim, I agree with you. I mean, I think the key thing we're looking at here is Christmas 2020 is unlikely to be like Christmas 2020, like a normal Christmas for many reasons. And I think Brexit, we are going to have to put into the Christmas period. We may see parliaments returning. We may see Zoom meetings and such like between Christmas and New Year. It is going to be all lastminute.com. And that has consequences for both how, whether there is clarity in things, whether there's confusion, whether there's work that needs to go on and go forward. And that's basically the space that we expect to be in going forward.
So, what are some of the issues? Do we have a deal? So, large parts of the potential deal are agreed. I think there's not a lot of controversy around them. As you mentioned earlier, the three outstanding issues are the level playing field, fishing, and governance. And for those that are less familiar, the level playing field refers to sort of the common standards or rules that prevent one sector gaining competitive advantage over another in another country. Fishing is a little bit more straightforward and easy to understand, and mainly focuses on access to British fishing waters by European boats. And then finally, governance, and sort of this refers to the legal mechanisms that one party can use to ensure that the other party holds to and doesn't breach the elements of the agreement. And this would probably involve some kind of independent arbitration, and this is what the two parties can't agree over. So to get, I'll just put these in, apologies. So to get a deal, one side or both is going to have to compromise on one of these three elements or all of them combined. And negotiations will have to conclude one way or the other by the 31st of December, I think. As I mentioned before, there's no appetite to continue a transition period. The deadline was missed to officially extend it, and I don't think that would stop it if the will were there, but the will isn't. One of the things that's being proposed, particularly for fishing, is to introduce review clauses. So at the end of 6 months or a year, a proposal will be put forward starting on the 1st of January, and then after that 6 months or a year, that would be reviewed. But this looks like it may be a sort of continued sort of negotiation with the EU for some time. I think the other thing that's important to keep in mind is parliamentary politics. So the Prime Minister is facing a lot of disgruntled Conservative MPs over COVID lockdown measures, and he's got a large number of MPs who would support a no-deal Brexit. I think opposition MPs, particularly the Labour Party, have said they would vote for a deal, suggesting that any deal is better than a bad deal. But it would be politically difficult for the Prime Minister if he needs to rely on opposition MPs to pass any deal. So the Prime Minister may be forced to choose between agreeing a deal in the interest of the country or to go with no deal to keep his parliamentary party happy and potentially remain leader of the Conservative Party. This is a little bit of conjecture, but it is a point that we could get to in the next month. And as mentioned, if we do get a deal, it's likely to be very, very slim.
Oh, I think it's a fair point, Tim. And if you look at the reason why the leaders of the Conservative Party ceased to be leader of the Conservative Party, Thatcher, Europe; Major, Europe; Hague, Europe; Howard, Europe; Cameron, Europe; May, Europe. It is a potentially difficult piece of UK parliamentary politics. But I think also, I mean, I just reflect on the three issues that they seem to be stuck on. And from a life science perspective, the life science industry is worth a bit over 30 billion to the UK GDP at the moment, and has the potential to grow. And I think has been at the heart of one of the discoveries, I hope, that will make a big difference in terms of economic recovery next year, which is vaccine and vaccine development. British fishing is worth around 1.4 billion to the UK exchequer, and if you are looking with an economic lens on the growth potentials of the future, perhaps some of the things that we've wanted as an industry might be important aspects of significant growth into the future.
Yeah, and I think sort of on that as well, sort of the comparison between fishing and other sectors, and fishing is such a totemic industry focused on the sovereignty of Britain, and goes back to sort of the factor tame cases in the 80s and legal disputes with the EU.
But Tim, the science is the totemic industry of Britain. Science has been has been, is what we are known for worldwide, and as a life science sector, this is what we are. Our brand is worldwide, and we should just be very proud of it. We've buried our scientists with our royals since Newton, and I'm very proud of it. And I'm going to be making the case for us being the key industry going forward. And I think I've got data and evidence to back that up.
And I think I would completely agree with you. I just worry that some MPs in Parliament may slightly disagree and see a fight with the EU overfishing as slightly more important than some of the history of the country itself and some of the technological developments that we've championed and discovered. But I think within all of this, there's a slight neatness that Brexit began with. I think trying to keep backbench Conservative MPs happy, and we may end up with no deal as a result of trying to keep Conservative backbench MPs happy as well, which would be slightly poetic if a little tragic. So moving on to specific implications for our sector. Given we like to have a skinny deal, we may miss out on some of the key annexes that the UK government was arguing for. So these were published a few months ago as a sort of draft proposal for discussion, and specifically included Annex 5D, which focused on medical products and covered a lot of basically was mutual recognition of things like including batch testing. I think a few months ago, my assumption was that if we didn't agree a deal, there'd still be an opportunity to argue for mutual recognition or a mutual recognition agreement outside of a deal. But I think now with time limited, there perhaps isn't that time left to agree it, even if we do end up with no deal next week. We know that the UK will continue to accept products batch tested in Europe until the 1st of January 2023, but we don't have that same commitment from Europe, and we don't believe any measures will be introduced. So on the current trajectory, medical products manufactured in the UK moving to Europe will need to be batch tested in Europe, which may be difficult. And finally, it's perhaps unlikely that a data adequacy agreement will be granted to the UK by the EU. We know this is being considered currently, but the ECJ has previously ruled that the UK's handling of personal data is not in line with EU law. And if we don't get a data adequacy agreement, it means that there'll be restrictions on personal data moving from the EU to the UK. The UK said it will continue to allow personal data to move from the UK to the EU, but if data can't move from the EU to the UK, that there will likely be implications for things like clinical trial administration and design that will need to be figured out, and potentially fairly urgently.
Tim, I agree, and I think these are the worrying aspects. And again, not knowing what the outcomes is with days to go now makes it almost impossible for us to be clear. These are big things that would make a big difference. Obviously, we've had some guidance from the European Medicines Agency some time ago on some elements of this, some guidance from the UK on some elements of this, but without everything tied down, you can't be ready for things which, if they were to change fundamentally, would be very, very difficult to change, particularly in the middle of a pandemic. So next slide, please. And of course, we've been making the case for many months, as you know, about the importance of having clarity and clear, and then not only clarity on what is wanted from both sides, the EU and the UK, but also the time to implement that. We have complex and difficult regulated supply chains behind our products. These things don't move very fast, and we've got to do this in an era of a pandemic. So we've been pretty vocal about this, and for some time. And we also know that there's not very much that you can do at a few days' notice. So I think the next slide is the country ready for this? I look beyond our sector at other things. Still don't have complete clarity on the Northern Ireland protocol. We need understanding on the time-limited phased approach that was announced earlier this month. What does that actually mean in practice? The systems that are being put together to go across the borders between the GB and the EU are untested. And if you listen to colleagues in the logistics industry or other places, they have their concerns, significant concerns about this. And when there is a test from the French side, we see the impact, as Tim highlighted at the beginning. And of course, the context of this is a country where many firms have been on furlough, or perhaps less resilient than last year across the sector. and we've not been able, there's been no Brexit readiness fund to be able to help you get ready in the way that we were able to last year. I hope we're doing that. So I don't think we're operating in an environment where the country is ready. Is our industry ready? Well, we've tried to provide you with the best information that we can, and today we'll continue to do that. And it's fantastic to have the officials on OLS who've done a great job to provide that to you. There was no opportunity for us to do the full round the country Brexit readiness tour that we did last year. No support for small and medium-sized enterprises like that this time round. There has been some greater flexibility shown from the letters from Steve Oldfield around the multi-leveled approaches for no deal, with some flexibility on stockpiling, and of course that system's sort of been operated through COVID, so there's some experience there. But again, I think we know that there's some risk in there, and I think there's some uncertainty around whether, so that we don't yet know whether the supply continuity measures will work in practice. We got up to the level of knowing that there's going to be ferries, but we've not run that. But tier one priority goods ferry system, the ticketing system, understanding whether the logistics world knows that. We'll be doing that de novo, and we know how difficult some of those things de novo can be. But I think we've tried, and we've certainly been trying to communicate, and we're as ready as we can be. And you can see that from statements from Richard, from the statements from others. So I suppose, I mean, where I sort of summarise where we're at the moment is we are looking down the barrel of a very bumpy Christmas and New Year period. We've consistently called for a comprehensive trade deal with the EU covering science, regulation, people and trade issues, as you've asked us to, with both the UK and with the European colleagues with the EU for many, many years. And there's overwhelming evidence that a comprehensive free trade agreement would be in the best interests of patients, industry and the economy, both in the EU and the UK. We've been consistent about this. We don't change. Not achieving that comprehensive deal would lead to consequences and lost opportunity for both sides. And then we've said, well, if you're not going to do that, we also think that there is value in looking at what we'd call a bare minimum to deliver mutual recognition agreement to cover batch testing and release, as well as GMP inspections and things like that. We don't think anybody would gain from not signing this, and these types of deals are around between the EU and many other countries, third-party countries, or third countries as they're called in the jargon. It's only patients that would lose out from this, and it adds, not having one will add massive complexity and cost in the supply chain at a time when we really don't need it, and we're trying to maximise supply chains at a difficult period of COVID-19. We don't want anything else that will add to delay or complexity. So I think where I sum up is we've done everything that's in our power to plan for all eventualities in this negotiation, including a no-deal scenario, but not everything is within the remit of industry or within our control. I mean, I'm really disappointed that patients haven't been prioritised in this negotiation, and I think there's significant risk now running. We'll continue to work both with the UK government and with EU partners to make the case that we've been consistently making for 4 years. And we'll do our best to ensure that patients aren't negatively affected by the UK's transition out of the EU, despite the significant challenges that are ahead of us. But on this, I don't feel that we're able to offer any guarantees given where we're at today. And I'm sorry it's a downbeat message, but I think that's where we are at the end of November. I would say that it's very important that we as a sector do everything we possibly can, and that's why we're going to use the second half of this webinar for the officials who work diligently and excellently, and thank them for their engagement to help us understand the fast-moving and complex nature of the changes that we are aware of, that we should be capable of engaging with. I know some of these are very late and very hard to do, particularly for a small company, but I am keen to give you, as best we can, the best information, and we've got the best people on to give you that best information today. And I encourage you to engage with it closely. Many of you will have done much of this already over the months, but there may be some new bits, and it may be a revision for you. And I hand back to Tim for what I hope is useful for the second half of this webinar.
And I mean, we've had a couple of questions come in. One talking about when will we know what the implications of the deal are for our sector, and one specifically on how potential changes to country of origin will impact on costs relating to tariffs and that kind of thing. And I think with both, the simple answer is we don't know, because we still don't have a deal. We don't know what the implications of that deal will be until we know what the deal itself is. I think some of the changes to country of origin we can explore, and I think if there is no deal, then perhaps that's something we can explore in our next webinar as well. Yeah, I think I appreciate some of the frustration, and that in some of these cases there aren't answers, because we simply don't have the answers, and nobody has those answers. So yeah, apologies for that. But talking about answers, I think moving on to our colleagues from the Office for Life Sciences, they should be able to tell us everything that we do know, and much of what they are able to tell us will apply regardless of whether we have a deal or not. So I don't know if you guys want to bring up your cameras where you can, and just to reintroduce Rob Reed, I think Head of Regulation in Engagement at the OLS, Elspeth Bailey, Trade Policy Advisor, and Jessica Kirby, Senior Policy Advisor. And I'm going to hand over the rest of the presentation to them.
Great, thank you very much, Tim. Thanks, Steve, and thank you for inviting us today to present at this webinar. I think what we're intending to do with these slides is to take you through the actions that businesses should be preparing to take at the end of the transition period. Obviously, the UK's position with regards to what it hopes to achieve through the negotiations has been published, as Tim set out. The UK negotiations are still actively trying to deliver on that medicines annex and the medical products annex, which would deliver, I know, many of those key asks from the sector. However, as Steve set out, we are rapidly approaching the end game, and so it's really important, I think, as we approach the end of the transition period in January 2021, that we're really clear on what it is that companies need to be doing to be prepared for new rules which will be in place at that time. If we could move the slides forward, please. Thank you. So we're going to cover a few things in this presentation. We're going to go through them relatively quickly. There are lots of links in the slides, and we will share the slides with the BIA, and are happy for these to be shared with the attendees to have access to the links contained within. There's obviously a huge amount more information available. I think we're very aware of the fact that there has been a veritable tsunami of guidance that's come from government departments and regulatory agencies. We've tried to pull out the things that we think would be most relevant to you, and we'll be happy to sort of take questions on these things. Where we can answer the questions today, we will do. If we can't, we will take those questions away and come back via the BIA in order to provide answers where we can. But the areas we're going to focus on for this, quick introduction to the Office for Life Sciences, a bit of context, and then we'll focus on, I think, medicines regulation. So it's a slight change to what's on the agenda here. After speaking with colleagues at BIA this morning, we'll focus on medicines regulation, the Northern Ireland Protocol, people, Horizon 2020 and Horizon Europe, and data. So if we can move on to the next slide, please. So firstly, a very quick introduction to the Office for Life Sciences. So we are a joint unit between the Department for Business, Energy and Industrial Strategy and the Department for Health and Social Care. So we have a kind of a foot on either side of the house. We are the sector team in BEIS, responsible for the life sciences sector. And through that responsibility, we deliver the industrial strategy and the sector deals. We also have a team dedicated to regulation and trade, and that's the team within which I sit, and also Elspeth and Jess, who are also on the call. And we're really focused on opportunities and challenges from the UK's transition, as well as looking at other international trade deals that the UK is active in. One of the key responsibilities for my team is engaging businesses and understanding both what the key challenges are for those businesses with regards to the end of the transition period, but also trying to ensure that they're as prepared as they can be with regards to understanding what businesses need to do at the end of the transition period. So if we can move on to the next slide, please. So a little bit on context and objectives, and it feels a little bit repetitive to what Tim and Steve were saying, but effectively the transition period will not be extended. That's not going to happen, so we need to be prepared for changes at the end of this year. In addition to that, the changes to medicines and medical devices regulation and supply are coming, and that's regardless of the deal that is agreed. If we are successful in negotiations and can deliver the medical products annex, which covers GMP of batch testing, mutual recognition of GMP inspections, that will go some way to reducing barriers to trade. However, we are leaving the single market, and therefore there will be new requirements in order to trade with the EU post December 2021. So in this session, we're hoping, as I said before, just to try and identify a few areas where we think are most relevant to you, trying to point to the sort of key actions that need to be taken, provide a bit of signposting, and as I said, we will share these slides and then hopefully answer any questions that you might have. Next slide, please. So we'll start off with a bit of information around medicines regulation at the end of the transition period. So the first thing to note is the grandfathering of centrally authorised product licenses. So these are the centrally authorised product licenses that the European Market Authorisation grants. Holders of these licenses will be contacted by the MHRA and given those licenses will be automatically grandfathered into a UK market authorisation effective in Great Britain unless companies opt out. So when being contacted from the MHRA, there'll be the opportunity to opt out of that grandfathering. However, if you don't opt out, then there'll be a period of 1 year starting from January 2021 to submit essential baseline data to the MHRA to support its role as the regulator of the MA in the UK. And so that will be in the form of an initiating electronic common technical document together with certain other market authorization specific information for each of the converted EU market authorizations. Moving on, please. For those CAP applications, those centrally authorized product applications which are in flight at the time of transition, there will be two options available to companies. Firstly, companies can look to apply for an in-flight assessment of a GB market authorization, which will then be conducted in parallel with the EU market authorization. In order to do that, the MHRA will look at all assessment that's already been reported on before the 1st of January, with a view to then completing the application for the GB marketing authorization no later than the Commission issues the decision for the CAP authorization. The second option available to companies is to wait for a positive CHMP committee decision from the EMA, and then to use that to apply for a GB marketing authorization using a new route to market, which the MHRA will be introducing from January, which is the reliance route to market. So this will effectively see the MHRA use the decision of the CHMP committee to make a quick decision for a GB marketing authorization in the context of GB clinical use. In both cases, there will be a need for applicants to submit an application and supporting dossier to the MHRA, along with accompanied with all the iterations of any CHMP assessment reporting conducted to that point. Okay, moving on, please. As I mentioned, the MHRA will be introducing a number of new routes to market. So I've mentioned the reliance route. There'll be 4 in total new routes to market in the UK, the first of which is probably the most interesting. It's the Innovative Licensing and Access Pathway. It's acronymed ILAP. This is a new pathway which will be launched from January. I think there are currently 5 products undergoing pilot for this pathway, which is effectively targeted at products which are deemed particularly innovative or with significant patient benefit. There's more information on this pathway, I believe, on the MHRA's web pages, but effectively it's a designation. The MHRA will designate a particular product as being appropriate for this pathway, and then that product is then able to benefit from early access to MHRA expertise, a kind of a modular approach to the development of the submissions, with a view also to early access to patients, early access to patients in a controlled manner. The second of the new approaches is a rolling review. So this is effectively a modular approach to submission. So it allows for parts of the dossier to be submitted, commented on, and comments received back, rather than waiting and submitting the entire dossier at the end. An accelerated assessment. This would be for all national applications in GB, and this is a reduced time frame to the usual 220 days, so it would bring it down to about 150 or 150 days for that national assessment route. And then finally, I mentioned this before, the reliance route. So this will be a route to a GB authorization, which will recognise the decisions that have already been taken by the CHMP committee on CAP authorisations in Europe. The UK will then do a risk-based review of that decision in the context of UK clinical practice and any GB-specific considerations, with an aim to issuing a market authorisation for GB in the same time frame as that's issued by the EMA. If we can move on to the next slide, please. So there are a number of new legal presence requirements that will come into play following transition. The first of these relates to the market authorization holder. So for grandfathered CAP market authorizations, which have a non-UK based UK market authorization holder, there will be a requirement to establish a market authorization holder in the UK within 24 months of January 2021. Also from the 21st of January, there will be a requirement for a UK or EU-based qualified person for pharmacovigilance. For any QPPVs who are based in the EU, there will be a 12-month, you'll have 12 months from the end of the transition period to establish a UK-based contact person who can act on behalf of the QPPV in the UK and to notify the MHRA of that establishment. With regards to qualified persons, and I'll come on to batch testing and batch release in a moment, but with regards to legal presence, QP for products manufactured in the UK or directly imported into the UK from a country not on an approved country list published by the MHRA will need to reside and operate in the UK. From January 2021, there's also a new role required for wholesalers importing QP certified medicines from the EEA, and that's the role of a responsible person for import. This person, I think, has been described as a sort of QP light in many ways, will be responsible for ensuring that the QP activity and the QP release conducted in the EU has been done so to the required standards before that product can be imported into the UK. Okay, moving on to the next slide, please. So in terms of packaging and leaflets, the changes to market authorization holder, changes involved in testing will all lead to changes in packaging and leaflets. As mentioned before, there must be an MAH within the UK within 24 months of the end of the transition period. That will trigger amended artwork requirements around name and address of the market authorization holder, for example, the Great Britain MA number, and then also the name and address of product manufactured for batch release. There will be a further 12 months, so in total 36 months from the 1st of January 2021 for companies to ensure that all stock released to market is in compliant packaging. So there's 24 months to establish the MAH in the UK, and then an additional 12 months to make sure that all packaging meets the requirements for the UK market. The MHRA will continue to allow multi-country packs, which include packs with more than one language on the pack or in the public patient information leaflet, as long as all of that information is compliant with UK requirements. Moving on, please. So I mentioned batch testing and release earlier. This is one of the areas which is contingent on what is agreed with regards to the future trade agreement with the EU. Obviously, the UK's desire for batch testing is a mutual recognition agreement, which is contained within the medical products annex as described earlier. However, if we find ourselves in a non-negotiated outcome with no deal agreed, or indeed in a skinny deal which does not contain the mutual recognition of batch testing, the UK has said that it will continue to accept batch testing conducted in EEA countries for a period of 2 years after the end of the transition period. So this is a slight change to previous no-deal guidance on batch testing, which had stated that the UK would continue to accept batch testing from the EU and would give 2 years notice of any change. That has changed now so that it is 2 years from the end of the transition period. So the legal default is that from the 1st of January 2023, batch testing would be required in the UK. The intention of this is to give companies time to adapt supply chains to future regulatory requirements. We're aware that it doesn't give a lot of time. However, this is the legal default as it currently stands. With regards to QP certification, from the 1st of January 2021, the UK will accept certification from countries on a specified list, as again published by the MHRA and available on gov.uk. That list will initially include all EU EEA countries and any other countries with whom regulatory equivalence has been confirmed. And that list will be reviewed on a 3-year basis. Okay, so moving on, please. So very quickly, there will be changes, obviously, to placing products on the EU market. In particular, the things to be aware of is that EU centrally authorised products will still be accepted in the EU market, and decentralised and mutual recognition procedure approvals will also continue to be accepted in member states in which they were approved. For market authorisation holders, for products placed in the EU market, will need to be based in an EU member state. And also batch testing and release of products to the EU market will need to be conducted in an EU member state unless, as I mentioned before, we agree the MRA on batch testing. Release would still need to be conducted in an EU member state. In addition, the QPPV for products in the EU market must also be based in an EU member state. Next slide, please. So there's more information, as I say, it goes into a lot more detail from the MHRA in terms of the guidance that they've provided, and that can be found at these links. We will share the slides and you can then follow these links. There's also details on regulating medical devices here. There were also a series of webinars delivered by the MHRA looking at changes post-transition period, and these have been held now, but I think they were recorded, so it is possible through the MHRA's pages on gov.uk to see recordings of those webinars also. Moving on, please. Okay, so I'll hand over to my colleague Elspeth, who's going to talk a little bit about Northern Ireland Protocol.
Thanks, Rob. So in this section of the presentation, I'll just run through the key principles of the protocol and touch on the regulation of medicines and medical devices under the protocol. Sorry, I'm saying So as you'll be aware, the purpose of the protocol was to prevent a hard border on the island of Ireland and ensure the UK, including Northern Ireland, leaves the EU as a whole. So the protocol will come into force at the end of the transition period, irrespective of any agreement with the EU, and is subject to a consent vote by the elected institutions in Northern Ireland every 4 years. So the first of these votes will happen in 2024. Now, under the protocol, Northern Ireland will align with all relevant EU rules relating to the placing of goods on the market of manufactured goods. The same authorities operating today will continue to be responsible for Northern Ireland. So this means that the MHRA will continue to be the regulator for Northern Ireland. Where Northern Ireland traders gain product approvals and certification for the Northern Ireland market from EU authorities and bodies, the UK will recognise these for the purposes of placing those goods on the Great British market. And this is moving on. And so a number of pieces of guidance have been published, but we are aware that more is needed and work is ongoing across government to remedy this. But however, until negotiations with the EU conclude, there will be some areas without complete certainty. So you can see the key pieces of guidance that have been published so far here, and as I've said, the links will be shared with you later. So you can see here the key principles of the protocol. So it ensures that trade going from Northern Ireland to the rest of the UK will continue as it does now, with Northern Irish goods enjoying unfettered access to the Great British market. There'll be no tariffs on goods remaining within the customs territory of the UK, and any additional processes on goods arriving in Northern Ireland will be limited as much as possible. And then finally, Northern Ireland will benefit from any FTAs that the UK strikes around the world. So turning quickly to medical devices under the protocol. So at the end of a transition period, most medical devices will need to be registered with the MHRA before being placed on the Northern Irish market. MHRA guidance sets out further detail. MDR and IVDR will continue to apply in Northern Ireland, and a CE mark will continue to be needed for devices placed on the Northern Irish market. UK notified bodies can continue some conformity assessments, but if this is the case, the new UK (NI) mark will need to be placed on the device along with the CE mark, and these products cannot then be placed on the EU market. As products with a UK CA mark will also need a CE or CE UK (NI) mark. And then, as stated before, the competent authority for Northern Ireland for medical devices will continue to be MHRA. So finally, moving to medicines under the Northern Ireland Protocol. Guidance has been published to confirm that medicines which have been certified by a QP and released for sale before the sale or supply before the end of 2020 have been placed on the market. This means that these goods under Article 41 of the withdrawal agreement can remain available for supply between GB, NI and the EU after the end of a transition period without any additional regulatory checks required. If you do plan to rely on Article 41, I would recommend that you familiarise yourself with the guidance, which you can see linked here on the page. Now, most recently for the protocol, the Department of Health, along with the Cabinet Office and supported by OLS, have been working hard with the EU to find a mutually acceptable approach to a full implementation of the protocol for medicines. And during the fourth meeting of the Specialised Committee, the UK and the EU agreed an approach on a phased process for implementing medicines regulation in Northern Ireland up to the 31st of December 2021. So this will provide the additional time needed for businesses to prepare in relation to batch testing, importation and the Falsified Medicines Directive requirements. Both the UK and the EU have issued statements on this, and the UK statement was linked on the guidance page shown previously. Moving forwards, we do expect further joint statement to be made between the UK and the EU. But we do appreciate there is a need for the underpinning technical detail, and we will continue to work closely with the Cabinet Office and with the Commission with an aim of providing aligned messaging between the UK and the EU. So moving on from the protocol, I believe we're moving to people next. Okay, so as I'm sure you will all be aware, there will be changes to how you hire staff from outside the UK at the end of a transition period. So free movement of EU citizens will have ended for the UK, and the UK points-based system will apply. Now, this system means staff from outside the UK need to accrue a certain number of points in categories such as salary and language requirements before they can be offered a role. And the new system treats EU and rest of the world workers equally. So there are a number of things that your business may need to do to continue hiring staff from outside of the UK, including ensuring you are a Home Office licensed visa sponsor and ensuring the job you offer meets a number of criteria. So for example, it has to be at the required skill level, which is A-level or equivalent, and has to be above the required minimum salary level. So this is action that you can take now. For citizens already in the UK, the new system will not apply, and they can apply to the EU settlement scheme for either settled or pre-settled status. And you can see the details on how to find the EU settlement scheme on the slides. So to take advantage of the settlement scheme, EU citizens must have been living in the UK before the 31st of December 2020, but they have until the 30th of June 2021 to apply for a scheme. At the end of a transition period, student visa routes will now also be open to EU, EEA and Swiss citizens under the criteria shown on this slide. So they have to be offered a place in the course, they need to be able to speak, read, write and understand English and have enough money to support themselves and pay for their course. They will also be able to take advantage of new graduate immigration routes that will be available from the summer of 2021. So turning briefly to the recognition of professional qualifications post-transition period. You may need to have your UK professional qualification officially recognised if you want to work in a profession that is regulated in the EU or EFTA countries. If you do need to do this, you should check the guidance from the country you want to operate in. However, you will not have to do anything if your qualification has already been officially recognised by a relevant authority in the EU or EFTA country. So there are a number of actions you can take to ensure you are able to provide regulated services in the EU from January 2021. So you should check the European Commission's Regulated Professions database and contact the single point of entry for the countries you want to work in and get your qualifications recognised by the appropriate authority or regulator in every country where you intend to work. So I believe I'm handing back to Rob now for Horizon.
Thanks very much, Elspeth. Can you move on to the next slide, please? So with regards to Horizon 2020, UK scientists and researchers and business can continue to participate and lead Horizon 2020 projects and also apply for 2020 grant funding. UK organisations can continue to bid into new calls for Horizon 2020 funding for the lifetime of the Horizon 2020 programme, and if successful, funding will be provided by the European Commission. So in order, when does this need to be completed? The UK participants will continue to receive EU grant funding for the lifetime of individual 2020 projects, including those projects which finish after the transition period ends on the 31st of December. And that includes any Horizon 2020 calls under the multi-financial framework, even if they extend into 2021 and after the transition period has ended. And then moving on to Horizon Europe participation. Next slide, please. Oh, back one. There we go. So with regards to Horizon Europe, which will run from 21 to 2027, this is subject to ongoing negotiations as part of the FTA. There was I think some media coverage of a potential change in the UK position, but the UK's position remains the same as it was at the start of negotiations, and that is that the UK is open to association to the programme, provided that a fair and balanced terms for participation can be agreed. And I think, therefore, what the UK's participation in Horizon Europe looks like will be clearer once we're clear on what the negotiations have delivered. However, if we do not formally associate to Horizon Europe, then the UK is committed to implementing ambitious alternatives as quickly as possible in order to address the funding gap. And the UK's aim under all scenarios remains for the UK to be able to participate in collaborative projects open to third countries, as well as wider international collaborations. More information on Horizon 2020 can be found at the link on the slide. Moving on, please. So I just really quickly want to run through data post transition period. Onto the next slide, please. So in terms of what your business needs to know, the EU, as I'm sure many will be aware, has an established way to allow the unrestricted transfer of personal data to countries outside the EU, and that's the adequacy decision. That means the EU will decide if UK GDPR is adequate protection for individuals' rights and to allow that flow of data. At the end of the transition period, if the UK has not received data adequacy decisions, the free flow of personal data from the EU to the UK will end. And to continue to lawfully receive personal data from EU organisations, alternative transfer mechanisms will be required. Without the appropriate protections in place, there is a risk that organisations could be operating unlawfully and face regulatory action with regards to the flow of data. Additionally, without adequacy decisions in place, the data protection provisions of the withdrawal agreement will come into effect, and these require certain personal data you may hold to be protected in line with EU data law. And moving on to the next slide, please. So in terms of what your business needs to do, preparing for new rules around personal data. So regardless of whether the UK and the EU agree a trade deal, if you send or receive data from the EU for business use, you may need to take action. If no data adequacy decision, as I mentioned, has been made by the end of the transition period, UK businesses will need to map out their data flows and look to put alternative transfer mechanisms in place to continue to lawfully receive data from EU organisations. The most common mitigation for this is through standard contractual clauses. You should familiarise yourself with the data protection obligations of the withdrawal agreement in order to ensure that you're in a position to comply. And then you can check how you can legally continue to receive personal data from organisations in the EU from the 1st of January by looking at information contained on the ICO, the Information Commissioner's website, where you can also stay up to date with the latest information and guidance on the ICO. So I think we will finish there. I appreciate there was an awful lot of information delivered fairly quickly. Happy to take questions, alternatively to come back on those post the webinar, but thank you very much.
Tim, Rob, and team, thank you. That was really, really useful. I'm conscious of time, and I realize it's for 2 minutes at the top of the hour. There's a number of expert questions or specific questions, and I'm wondering, Tim, if we can find a process to gather those questions and write back to participants in the webinar with the answers as best we can give them with Rob's team out with this call, because otherwise we're going to go through the top of the hour. So is that possible, Rob, Tim?
Yeah, from my perspective, I mean, if you have a question now, please do put it in the chat and we'll collect them, and then we have your email addresses that you having registered, so we can make sure those get out to you. I think likewise, if you have any questions ahead of our next webinar, which is likely to be in 2 weeks' time, then please email them to us in advance, and we'll do our best to either answer them then or ahead of the next webinar.
So I think question.
Sorry, just to confirm, I'd be very, very happy to take those questions and come back to you on them.
That would be brilliant. I'm conscious of people's time. So I think if I may, in summary, we have here sort of a deep dive into what feels like a lot of detailed change, and in a sense there is a lot of red tape coming at us, and the question is to get ready. And I know some people, rules is fun and they like that, and there will be lots of opportunity to get them and want to get it right and get it perfectly, and you'll be asking us questions so that you can do that properly. We're guiding you to where we know you can, and hopefully you can do as much of it as possible. And we know that the risk there is in the uncertainty. You don't mind what it is, just tell us what it is that you need us to do. And we know that we haven't got that completely. I think the other thing I'd say is, if you take a step back, actually the UK life science sector is really vibrant and in a fantastic place. You look at what we've delivered as an ecosystem this year in terms of working together through the recovery trial, the only health system and ecosystem that's delivered data on COVID-19 therapeutic. And we're amongst the leaders in terms of developing vaccines with the work that's gone on through Oxford, Vaccitech and AstraZeneca, as well as trialling lots of those things in the NHS. So in COVID, I think we've shown ourselves to be world leaders. And if you look at the structural changes that are happening in terms of our genomics data, in terms of our capacity to do innovative clinical trials, if you look at our fantastic academic and scientific base, and the speed at which companies are growing in the UK, we've lots to be proud of. And I think we should put this in this, which is going to be a difficult moment with lots of change and lots of perhaps some cost for companies in it, into the context of that bigger picture. We can have a positive view as we go into 2021, and there's lots there. What we've tried to give you today is the capacity so you can manage the short-term issues. But if you are talking to global, do remember that this fits into a bigger picture of a really vibrant and strong UK life science sector that is well set for many of the key challenges that we're going to see going forward. With that, Tim, I hand back to you.
Brilliant. Well, yeah, like I said, please do keep continuing to post your questions, and we'll get make sure they get answered. We'll probably put them up on our website. And just one thing before we go, just to finally plug our annual BioProcessUK conference, which is taking place next week virtually, with a focus on obviously COVID-19 vaccines and therapies, the UK's biomanufacturing landscape. It should be a really good one. We've got a great lineup for you. And then I think all that's left to say is thank you. Our next webinar is tentatively scheduled for the 10th of December, but we'll likely be confirming that early next week. So thank you so much for joining us. Thank you so much to Rob, Elspeth, and Jessica from the OLS for coming and presenting us that incredibly useful information. This webinar should be up on our YouTube channel fairly shortly, and some of the key links from this will be available on our BIA Brexit portal as well. So look out for that.
Thank you, everyone. Have a great week. And if things change, we'll make sure we've got information.
Brilliant. Thanks so much, everybody.